Bridge, new frontiers in type 1 diabetes.
When an individual has been screened positive for presymptomatic type 1 diabetes, the next step within rather short time frame is to take another confirmatory sample to see that this is definitely true, that islet autoantibodies are there. And at the same time, we can start glucose metabolism monitoring, for example, by measuring hemoglobin A1C level or just random plasma glucose level. Then there are other methods. A very modern one is continuous glucose monitoring, where you monitor the tissue glucose level for a period of 10 to 14 days, and that method gives a lot of information about glucose level variation in the tissue level, which correlates very well with plasma glucose. Then we have oral glucose tolerance tests. That is a very informative method and can distinguish whether the individual has stage 1 or stage 2 type 1 diabetes, and that will take 2 hours, but is doable even with young children, not everyone, but because the information content is so high, that is still a valuable method to be performed as one tool of the monitoring. And of course these methods have to be discussed with the individual or the family and then agreed about how to perform these.
It's very important to monitor people who are positive for autoantibodies, because you can prevent diagnosis in ketoacidosis, you can follow them, so help families to prevent a diagnosis with complication and admission in the hospital. So the follow-up is very, very important.
When people are diagnosed with prediabetes, in other words, that they're antibody positive, it's normal to be anxious about that. But it's helpful to encourage them to know what to do and what to look out for. The key points are they need to know the symptoms of type 1 diabetes, so they would never let it get too late.
Bridge, new frontiers in type 1 diabetes.